Hypnosis to Change Your Life with Dr. Steve G. Jones.
How long does your hypnosis session usually last, Steve?
Okay, great question. And for me, the way I like to work with clients is I like to see them for 2 hours the first time. Now, we're not doing hypnosis that whole time. A lot of times we're just talking like this. Mm-hmm. Now, when I see a client, I wouldn't sit like this on a couch with them because I would consider that to be inappropriate. I should point that out. I would sit in a separate chair. I've got them in the comfortable chair with their blanket if they want one. I'm in a separate chair. But as far as the length of time goes, I like to see them for 2 hours the first time. Now, you might think, what in the world are you doing for 2 hours? Well, for the first hour, I've set aside for them a time to just talk. And you would be amazed at how people who have kept things inside for a long time that they haven't talked about with anyone, when they unload for a long time. Sometimes an hour isn't even long enough. I have to cut them off at an hour because we have to move into the hypnosis session. They've got a lot to say. A lot of times my job is just how people kind of stereotypically make fun of a psychologist. Psychologists, they'll say, would just sit there and say, uh-huh, and how do you feel about that? Uh-huh.
Exactly.
Well, a lot of my job boils down to, uh-huh, and how do you feel about that? Because I'm taking notes. I'm getting information from them. Now, the other type of client, one type is the type of client that hasn't talked to anyone in years and they're ready to just unload on you. And it's like drinking water from a fire hydrant. You're thinking, how am I going to get all this down? The other type of client is the kind that's very reserved. You know, they come to you and they think you have a magic wand you're going to wave and they don't need to give you much information to go on and they're just waiting for you to do your job. So they don't give you much information. They're just kind of piecemeal. Mm-hmm. So you have to ask leading questions during the time.
And if someone were not to know that about themselves beforehand, how do you figure that out?
If someone didn't know
how you're going to treat the different clients.
Okay, great. If they didn't know what was going to happen during the hypnosis session. A lot of people don't. They have misconceptions. In fact, they ask if I'm going to make them cluck like a chicken. And I always say, I charge extra for that.
Yeah.
And so disarming something with humor is always powerful as long as it's appropriate humor. You know, never use filthy humor or anything like that. But when you can disarm it, something that they're so nervous about, like some people think that I might actually make them cluck like a chicken or something like that. So when I disarm it with humor, the anxiety they had about that gets focused on the humor and they're able to laugh it off. Oh, okay, good, he's not going to do that, I hope. You know, they still have a little bit of concern. Yes, some people actually have misconceptions like that. They think that. So I always clear that up in that hour with what's called a pre-talk. The pre-talk is the education of the client for the client's benefit. Let them know that you're not going to put them in a coma. Mm-hmm. They're going to come out of it. You're not going to make them do strange things against their will. You do know what you're doing. You do have education. You have credentialing. You have a certificate. You have a diploma. You have whatever you have. You'll be glad to show that to them if they want to, if they ask for it. That's the time where you clear up all the anxieties, answer all the questions. So a lot of people don't know ahead of time. Now the second hour, let's go back to the first hour. Sometimes when you've got the fire hydrant coming at you, all this stuff, and you're thinking, okay, I've got to get this pre-talk in, but I'm getting this barrage of information from the person. Where am I going to get the pre-talk in? Sometimes the pre-talk has to be done in sort of a dance kind of way. You've got a lot of information from the client. You see an opening where you can give them some information that they need and say, oh, yes, and that reminds me, along those lines, you may be aware of everything I say during this session, and that's okay. That's an important bit of information to share with them.
Exactly.
You need to let them know they may be aware and they may remember the session. That could happen. You don't want them coming out of it thinking, well, I wasn't in hypnosis because I remember. You need to get that disclaimer out there because you can still be in hypnosis without realizing it. So then we move into the second hour. The second hour is all about hypnosis. So it's time to use the restroom if you need to. It's time to blow your nose if you need to. Whatever they need to do.
Get comfortable.
Right. Whatever they need to do, they need to do it. And then it's time. Then it's hypnosis time. Okay. So we're drawing attention to it. Now is the official hypnosis time. Hypnosis doesn't just happen where I'm talking to them and then bam, I put them into hypnosis, and I tell them that I'm not going to do it that way. There's a specific time when we're going to do it.
Is there a reason for that?
Yes, because you don't want to catch them off guard. You don't want to make them more nervous than they already are.
Mm-hmm.
They're already coming in thinking, "Oh my goodness, when's the Jack in the Box going to come out? When am I going to cluck like a chicken?" They have all these thoughts that are based on their anxiety, and their anxiety is based on their lack of knowledge about what's going on. So you need to diffuse that with a little bit of humor and a lot of education. And so the second hour, you're working on getting them prepped for hypnosis, getting them hypnotized, getting them out of hypnosis. The actual hypnosis session probably takes about 30 to 45 minutes, somewhere in there.
Mm-hmm.
Then bringing them out of hypnosis, giving them a chance to reorient themselves to both time and place, where they are, what time it is.
Mm-hmm.
You ask them, you make sure they know where they are and what's going on and so forth before they drive off somewhere. And then driving is fine afterwards as long as they're fully back and they can demonstrate that. If they stand up and fall down, they need to go back in the chair and wait, or somebody else needs to drive them home. Right, if they're still acting as if they're dazed, something's up, you need to perhaps redo the trance termination where you bring them out of hypnosis again, just to make sure they're fully aware. So that's why you need a little bit of time afterwards. The second hour, though it's devoted to the hypnotherapy session, is not all hypnosis. A little bit of prep time, a little bit of time at the end to come out of it, a little bit of time to handle payment if they're going to pay at that time. We require payment ahead of time, but if they're going to pay you at that time, schedule next appointment at that time, things like that.
If someone were going to make an appointment but wanted to see you for one time in the beginning, and they didn't know if they wanted to make another appointment, do people do that?
Oh, absolutely, all the time. In fact, that's very common. People see me or see a hypnotherapist, and they talk to them ahead of time and find out, well, what you have or what you're going through normally takes 3 to 6 sessions. Okay. They don't want to commit to that because they've never test-driven the hypnosis session. So they want to come in and kind of get their feet wet before they dive in. And that's fine. I always honor that because I know that either A, they'll get what they need during that session, B, they'll find out it's not for them, which is fine also, or C, they'll be more committed to the process. And that way they'll be on board without having to have made this commitment, which is a commitment to something they didn't really know about.
Can you ever come into a hypnosis session not having one specific thing you want to talk about?
Absolutely. You can always come into a hypnosis session not knowing what you want to work on as long as something is discovered during it. Some people just know that they want to have sort of a cleansing, if you will. Okay. They want to clean out some thoughts from the past. They want to just work on being I don't know, more in tune in general, but they don't know exactly, they don't have a word for it. They don't have the word confidence or the word motivation or anything like that. So they come into the session not knowing exactly what they want, but it's easy during that hour to find out what they need to work on and to give it a label. Labels are always powerful. If you give it a label, okay, confidence is what we're talking about here. Motivation is what we're talking about here. And then you focus on that. It's usually pretty easy to figure out what they want to work on, to give it a label, and to move forward. So I always honored that. If somebody comes in and they say, yeah, I don't really know what I want to work on, but I know this is going to be good for me. And I say, come on in. We'll figure it out.
Great.
Hypnosis to change your life with Dr. Steve G. Jones.